Have you ever walked out of a doctor's office feeling dismissed? You tried to explain what was wrong, but were just told, "It's a normal part of getting older." You felt unheard, maybe even a little silly for even bringing it up. As if your concerns were just the expected aches and pains of a long life, not worth a real investigation. What if I told you that feeling is not in your head? And what if the real reasons you were dismissed have almost nothing to do with you, and everything to do with the hidden biases and pressures baked right into our medical system? Recent surveys show that about 1 in 5 older adults feels they've experienced this kind of ageism from a doctor. It's a real, systemic problem, and it has a huge impact on your health. In this video, we're pulling back the curtain on the 5 surprising reasons older patients often get worse care, and what your doctors are really thinking but can't or won't say out loud. More importantly, we're going to give you the tools you need to fight back and get the care you deserve. Our mission here isn't to scare you, it's to empower you. We believe that knowledge is the best medicine. Understanding the incredible pressures and unconscious biases your doctor is facing is the first step toward protecting your own health. This isn't about blaming individual doctors. It's about understanding the system they're stuck in, so you can navigate it safely. This isn't about making you angry. It's about making you an advocate for your own life. If you believe in that mission, take a second to subscribe to the channel. We are dedicated to bringing you the insights you need to take control of your health journey. Now, let's jump into the first hidden truth, a concept so common it has a name, yet so few patients have ever heard of it. The first thing you need to know about is a chilling concept called therapeutic nihilism. It's a deep-seated, often unconscious belief in medical culture that aggressive treatments just aren't as effective, or are simply not worth it, for older patients. It's the quiet assumption that because someone has already lived a long life, their future quality of life doesn't justify the same medical investment as a younger person's. Think of Robert, a vibrant 78-year-old who loves gardening. He gets a serious diagnosis that, for a 50-year-old, would be met with an aggressive treatment plan. But his doctor, maybe seeing the gray hair and the birth date on the chart, hesitates. The doctor might think, can he handle the side effects? Is it worth putting him through all this at his age? This hesitation isn't coming from a bad place, but from a widespread, negative stereotype about the frailty of older adults. The evidence for this is alarming. Major reviews of hundreds of studies have shown that age is frequently the deciding factor in whether or not a patient is offered certain medical procedures or treatments. This isn't based on their actual health, their vitality, or what they want for their own life. It's based on a number. In fields like cancer treatment, this bias has devastating consequences. Older adults are often left out of clinical trials and may be offered less aggressive care, not because they couldn't benefit, but because of this underlying belief. It's a form of quiet rationing that happens in exam rooms every single day. The doctor might not even realize they're doing it. They see age as a complication instead of just a number. And just like that, a decision is made that limits a patient's options and can lead to much worse outcomes. The second reason your care might be suffering has less to do with bias and more to do with a ticking clock. We call it the 15-minute tyranny. The entire healthcare system is built for speed and volume. Doctors are often scheduled to see a new patient every 15 minutes. For a young person with one simple problem, that might be enough. But for an older adult, it's a recipe for disaster. Think about your own medical history. It's probably a more complex story. You might be managing a few chronic conditions at once. You're likely taking several medications, all with their own rules and potential side effects. Your symptoms might be more subtle or show up differently than they would in someone younger. Explaining all of that well takes time the system simply doesn't give you. One study found that, on average, doctors only listen for about 11 seconds before they interrupt. Imagine asking a master jeweler to fix a rare, antique watch but only giving them 60 seconds to do it. They couldn't possibly study the delicate gears or understand its unique design. They'd be forced to make a quick, sloppy fix and move on. That's what the 15-minute appointment does to your doctor. It forces them to take mental shortcuts. It's also a primary reason for physician burnout, a state of exhaustion that now affects over half of all doctors. This crushing time crunch has dangerous results for you. It can lead to a prescription cascade, where a doctor, out of time, just prescribes another drug to treat what is actually a side effect of a different medication. It leads to misdiagnosis because there's no time to hear the full story. That feeling you get of being rushed, of the doctor having one hand on the doorknob, that's a direct result of the pressure they're under. They aren't trying to be rude. They are trying to keep their head above water in a system that prizes quantity over quality. But you're the one who pays the price. All this pressure and bias poisons the very core of good medicine: communication. The third hidden truth is that the way doctors talk to older patients is often completely broken. It breaks down in two ways: using elder speak and simply not listening. Elder speak is that patronizing, syrupy, sweet way of talking people sometimes use with older adults. It's the "How are we feeling today, dear?" voice, using baby simple words, or talking extra loudly as if everyone over 65 is deaf. Even if the person means well, it's demeaning. It instantly changes the dynamic from a partnership to a parent talking to a child. And when you feel patronized, you're much less likely to bring up an embarrassing symptom. You figure, why bother? They won't take me seriously anyway. The second part of this is the failure to listen. As we said, doctors are rushed, but ageist ideas also come into play. There's a bad habit of blaming symptoms on old age. Fatigue is just slowing down. Dizziness is just part of getting older. This isn't just disrespectful, it's dangerous. These could be the first signs of serious problems like heart disease or a neurological issue. When a doctor just waves off a symptom without looking into it, they're slamming a door that might have led to a life-saving diagnosis. This breakdown directly hurts your health. When you feel disrespected, you check out of your own care. You're less likely to follow a treatment plan because you don't feel like you were even part of the decision. Let's take Eleanor. She's sharp and lives on her own, but her doctor talks to her like she's a toddler. He barely makes eye contact, just types on his computer. She tries to tell him about a nagging pain in her shoulder, but he cuts her off with, "Aches and pains are to be expected." Eleanor leaves feeling angry and invisible. She doesn't bother with the physical therapy he vaguely mentioned, and 6 months later, that simple ache lands her in the ER. It's a severe rotator cuff tear that now needs major surgery. That entire disaster could have been avoided with one simple act: respect. You'd think the doctor treating your 75-year-old body has been trained extensively on how that body works. The fourth hidden truth is a shocker. Many, if not most, doctors have a major knowledge gap when it comes to the specific needs of older adults. Geriatrics, the specialty of caring for older people, is not a required part of most medical training. This is a huge problem, because an older body isn't just a stretched-out version of a younger one. It handles medicine differently. Symptoms of a disease show up differently. A heart attack in an 80-year-old might not be crushing chest pain, but sudden confusion or a fall. Depression might not look like sadness, but like grumpiness or apathy. Without special training, a doctor can easily miss these signs. Think of it like this. You wouldn't take a priceless vintage car to a mechanic who has only ever worked on new Teslas. That mechanic might be a genius, but they don't have the specific knowledge for your car's unique engine. In the same way, a doctor without geriatric training might be excellent, but they're working on a type of engine they don't fully understand. Studies show that when doctors get more education in geriatrics, their negative attitudes improve, and so does their care. This knowledge gap is especially dangerous with medications. Polypharmacy, taking multiple prescription drugs at once, is incredibly common among seniors. A doctor without deep geriatric training might not appreciate the complex, risky interactions between all those pills. They might prescribe a new drug that clashes with an old one, leading to falls, confusion, or a trip to the hospital. It's a silent epidemic happening in medicine cabinets everywhere, fueled by a gap in the education of the very people we trust with our lives. This last reason is maybe the most human of all, and it helps us see the doctor not as an enemy, but as a person trapped in a bad system. It's called compassion fatigue or just plain burnout. The healthcare system is a pressure cooker. Doctors work insane hours, have massive patient loads, and are buried in paperwork. They are on the front lines of human suffering, dealing with pain and death day after day. Over time, that constant stress can wear down a person's ability to feel empathy. It's a defense mechanism to survive the emotional toll. A doctor might unconsciously put up a wall. They might seem detached, indifferent, or just lack the warmth you need. This isn't because they're a bad person. It's because they are burnt out. The system has literally wrung the compassion out of them. Research shows that physician burnout can lead to problems with attention and memory, which directly threatens patient safety. A burned-out doctor is more likely to make a mistake. That distant, distracted vibe you're getting might not be about you at all, but a symptom of their own deep exhaustion. They are just trying to cope in a work environment that is completely unsustainable. This doesn't excuse bad care, but it does help explain it. It reframes the problem from bad doctors to a sick system that is failing everyone, both patients and providers. Understanding this helps you approach the situation not with anger, but with a strategy. You're not just dealing with a person. You're dealing with a person who is a product of a broken environment. So, knowing all this, the biases, the time crunch, the knowledge gaps, and the burnout, how do you fight back? Not against your doctor, but for yourself, inside this system. You have to become an active, prepared partner in your own healthcare. Here are 4 powerful strategies you can start using today. First, create a pre-appointment briefing. Before every visit, get 1 sheet of paper. At the top, list your 3 most important questions. Below that, list your current medications and dosages. At the bottom, list any new or changed symptoms. Hand this to the nurse or doctor right at the start. This does 2 things. It forces the visit to focus on your priorities, and it delivers critical info clearly, saving precious time. Second, use the record and recap technique. At the start of the appointment, just ask, "Do you mind if I record our conversation on my phone so I can remember everything later?" Most will say yes. Then, at the end, you recap the plan out loud. "Okay, so just to be clear, I'm starting the new heart pill. I'll watch out for dizziness, and we'll follow up in 1 month. Is that right?" This makes sure you're both on the same page and gives you a record to listen to later. Third, use I statements to push back against dismissal. When you feel a symptom is being brushed off, don't get mad. Get specific. Instead of, "You're not listening," say, "I am really concerned about this fatigue because it's stopping me from going grocery shopping. I need our help to figure out why this is happening." This centers the conversation on your quality of life, which is much harder for a doctor to ignore. Finally, bring an advocate. This can be a family member, a good friend, or a professional patient advocate. A second set of ears is priceless. They can take notes, ask questions you forget, and just be there for support. Having someone else in the room completely changes the dynamic and makes it much less likely your concerns will be waved away. The relationship between doctors and older patients is strained, not by bad intentions, but by a system that creates bias, burnout, and bad communication. From the quiet dismissal of therapeutic nihilism and the crushing 15-minute appointment to the patronizing tone of elder speak and the real gaps in geriatric knowledge, the hurdles are real, but they are not unbeatable. This knowledge isn't meant to make you scared. It's meant to make you prepared. It's the key to changing your role from a passive patient into an empowered advocate for your own life. You have the right to be heard, to be respected, and to get the best care possible. If this video opened your eyes, and you believe that every senior deserves to be heard and respected, then please, hit that subscribe button. Our whole mission is to give you the tools you need to fight for your health and live your best life. And please, share this video with a friend, a parent, or anyone who needs to hear this. You never know whose life you might change. Now, we want to hear from you. Have you ever felt dismissed or unheard by a doctor? Share your experience in the comments below. Your story is powerful, and it helps everyone in this community feel a little less alone.